Hello, everyone, and welcome. I'm Don Lemon in New York.
I'm Dr. Sanjay Gupta. Welcome to the CNN Global Town Hall, The Color of COVID, the vaccines. We're being seen around the world on CNN International and online at CNN.com.
It's a pleasure to be here with you, Sanjay. And as we speak right now, a second COVID vaccine, the one from Moderna, has just received emergency use authorization from the FDA. A tremendously important new development, especially in communities of color, which have been so hard hit by this pandemic, Sanjay.
Yeah, that's right, for sure. But that hope that you're talking about, as you know, is also tempered by hesitancy or even outright fear. And that's why we're here tonight, to provide transparency and to get straight answers to questions we may have, you may have, about keeping your loved ones safe. Also, Don, I don't know if you know this, I received the vaccine today at the hospital where I work, and I'm going to tell you about it later in the show.
Yeah, I saw that. It's very important, especially with someone of your profile and with your knowledge, to get it so that people can see that it is okay. As you said, we've got a lot to talk about today. So joining us tonight, we're going to get some answers to the vaccine. They're going to answer your questions. We're going to make questions and hopefully allay some of the fears. That's from Dr. Anthony Fauci, perhaps the nation's foremost infectious disease expert, and the Surgeon General, Jerome Adams, who he got vaccinated today as well, Sanjay.
That's right. That's right. Also joining us, other leaders in the medical field, including the head of Morehouse School of Medicine, Atlanta, leaders in the faith community, and a historic first, one of the first people in America to get the vaccine this week.
So we want to hear from you. So make sure you do this, right? We want your feedback. We want your questions. Tweet us your questions with the hashtag CNN Town Hall, or we want you to leave a comment on the CNN Facebook page. So a lot of you have sent them in video form for us, so you can see some of them up on the screen right now, and we're going to get to as many as we can tonight. So thank you so much. So we're going to start with where we are right now. And ready, 1, 2, 3. As the first vaccines outside of clinical trials were administered nationwide this week, many of the hardest hit communities remain reluctant to receive them. A study from the Kaiser Family Foundation finding 35% of Black Americans would probably or definitely not get the vaccine if it is determined to be deemed safe by scientists and widely available at no cost. The U.S. Surgeon General today acknowledging the lack of trust is not without good reason, citing the Tuskegee experiments on African American men that began in the 1930s and went on for more than 40 years.
To truly promote confidence in these vaccines, we must start by acknowledging this history of mistreatment and exploitation of minorities by the medical community and the government. But then we need to explain and demonstrate all that has been done to correct and address these wrongs.
There's also concern among the Latino and Native American communities as well. According to the CDC, Black, Hispanic, and Native American people infected with COVID-19 are about 4 times more likely to be hospitalized than white people, and are nearly 3 times more likely to die from the virus. There is good news. People of color, according to the Kaiser study, overwhelmingly said they would trust information about the vaccine if it came from their personal healthcare provider. Now the task remains to build on that trust nationwide.
The first thing you might want to say to my African American brothers and sisters is that the vaccine that you're going to be taking was developed by an African American woman. And that is just a fact.
And he knows the facts, Sanjay. And by the way, he said the first was taken by an African American woman, right? The first American believed to have gotten the vaccine is a woman of color.
That's right.
Name is Sandra Lindsay, a nurse at Long Island Jewish Medical Center in New York, the New York City borough of Queens, rolling up her left sleeve on Monday morning, right? She grew up in Jamaica, not the one in Queens, by the way, and is director of the critical care nursing at Long Island Jewish Medical Center. And she's seen this virus, what it can do. She's seen it up close. And guess what? She also joins us right now. We're so happy that you could join us tonight. Thank you so much. So Sandra, Sanjay got it today, and I think he only has a sore arm. And how are you feeling? Are you experiencing any other side effects other than a sore arm?
No, Don. First of all, thank you very much. I'm honored to be on your program and to be in the presence of so many esteemed experts who have listened to for many months. No side effects at all, not even soreness in my arm today. No inflammatory responses that the experts have said that I may experience. I didn't experience any weakness, no pain. I feel great. I went back to work the next day.
Wow, good stuff.
It bodes well for me. I'm right behind you, Sandra. Sandra, you know the theme of tonight, talking about vaccine hesitancy. You said you wanted to be one of the first people to receive this vaccine so that you could lead by example. So it's been a few days now. I'm wondering, have you found that to be true? Have people been encouraged by seeing you get the vaccine?
Sanjay, so many people have reached out to me via text, via email, come up to me at work the next day to say, Sandra, I got the vaccine. I was so inspired by you. Thank you for leading us. Thanking you for being so brave and courageous. And that was the intent.
I've got to ask you, Sandra, because Queens was hit really, really hard, and we were, thinking about the folks on the front lines like you during the height of this, in the beginning of this epidemic. It's still going on. You have been on the front lines of this since the very beginning. I know right now your hospital is experiencing a surge. So to those who are still scared to get the vaccine, give us your message to them tonight.
I want to tell them that, to your listening audience, to everyone around the world, this is not a hoax. This is real. I've lived it. I know that our past, the legacy of the past, still looms darkly over, minorities, blacks, Hispanics, Latinos, black and brown people. But every day since March that I entered work, each day has gotten darker and darker. I have seen the effects of it, and I don't want to see you end up in one of our ICU beds or enter our hospitals. So many people have made tremendous sacrifices to save lives. And you see healthcare workers, essential workers, both in and out of the hospitals, in our schools, in our restaurants, have been telling us how tired they are. One thing you can do for us, partner with us. Let's partner together and put an end to this pandemic once and for all. Let's bend that curve. Let's crush that curve and keep it down.
She's convincing me. Well said, right, Sanjay?
Absolutely. People need to hear this message, because no one who gets this expects to get it, right? They're all surprised. They develop a few symptoms, and then it gets worse. I'm curious for you, Sandra. I know you've only had one of the two shots, but do you psychologically feel different? Do you feel less worried or different in any way?
Dr. Gupta, I've been saying to my colleagues, in my 26 and a half years of nursing, I have never felt so afraid. And so tonight, and right after the shot, you saw that I applauded. I felt like the burden of fear had been lifted off my shoulders. I feel so good. I've been saying to all of my friends, the leaders in the organization, I am ready for this shot. I can't wait to get it. I am done. We need to put an end to this. And so tonight, I just feel so relieved and encouraged. And when people look at me, I want them to see hope. That's the message I want to send to everyone. And the vaccine is no good in a freezer. It needs to get in our arm. It's the vaccination piece of it. And so I've heard as well that, the second shot, I may feel lousy. It's a booster, so it's going to boost your immune system and may make you feel bad. But I am ready for it. I am ready for it. I encourage everyone who took the first shot, don't be discouraged by what you may experience in the second shot, because it's a good thing. It means that your immune system is working.
It's working. Yeah.
Right.
Sanjay, she is an example of nurses all over the country, all over the world, right? What they do and how they care for people, and just the example that they set. Sandra Lindsay, thank you so much, and I'm sure you'll attest to this before we go. I know you said that you felt like a weight had been lifted, but you can't let up yet. You still have to take the precautions, right? Because not everybody's been inoculated and gotten the vaccine.
Correct. And so we know it's the time of year when we get together and celebrate with our friends and family, but we can't let up yet. The finish line is close, but we haven't crossed it yet. So continue to practice hand hygiene, social distancing, wear your mask. And Dawn, if I may just say, I'm a nurse. I'm representing nurses. I'm representing healthcare workers. There have been so many unsung heroes in this fight, and I just want to take 1 second to acknowledge them. Our respiratory therapists, I want to acknowledge our patient care associates who support us nurses, the supply chain personnel, the people who provide us food or food and nutrition, all the people, the unsung heroes, people, the essential workers outside of the hospital, our administrators who have to, every day, it's a challenge. Where are we going to expand? Where are we going to surge to? How are we going to keep people safe? That's a huge responsibility. And so we just want to acknowledge them. And I want to thank the scientists who led the way so that I can feel this sense of relief and joy. Thank you so much.
We are grateful right along with you, and we thank you very much, Sandra Lindsay. Appreciate you coming on.
Thanks, Sandra.
And thanks for your work, and especially for the example that you set this week. So, joining us now is Dr. Anthony Fauci and the Director of National Institute of Allergy and Infectious Disease. Also, Dr. Jerome Adams, who is a U.S. Surgeon General and COVID vaccine recipient, a new COVID vaccine recipient. We're so happy to have both of you on. Thank you so much. I'm going to start with you, Surgeon Adams. We shared at the top of this program, right, that you got the first dose of the vaccine live on air this morning. So first of all, tell us how you're feeling and why this is so important for you to do this publicly.
Well, physically, I feel fine. I heard Sanjay talking earlier. I got a little bit of a sore arm in the last couple of hours, but that's normal. That happened after my flu shot. You can have a fever. You can have a mild headache. That's the vaccine working, as Sandra said earlier, but I don't have that yet. And emotionally, I just really am pumped. I'm really pumped because this is, again, the light at the end of the tunnel we've been waiting for. This is the beginning of the end. And make no mistake about it, it's going to be a hard couple of weeks. We've still got work to do to get over this surge. But I want people to be encouraged. And I did this on TV because I want people to understand I've looked at the data. I've worked with the companies, and I felt safe getting the vaccine. It is okay. It's okay to ask questions. It's okay to wonder, is this right for me? But what's not okay is to let misinformation cause you to make a decision which is bad for your health. I looked at the data. I made a decision that I thought was appropriate for my health, and that's all I'm asking your viewers to do too.
All right.
Dr. Fauci, we have some video of Vice President Pence as well, and the Second Lady getting vaccinated this morning alongside the Surgeon General. We know that President-elect Biden plans to get his first dose, I think, on Monday, in part for national security reasons. It does raise the question, I mean, should President Trump get vaccinated? I know he had the infection, but what would you recommend in this case?
Well, that's a personal choice, Sanjay, between the president and his physicians. One of the things that you have to keep in mind that he received a monoclonal antibody when he was ill, so he still might have a very high level of antibody in his system, which you might want to wait a bit before you actually vaccinate him. So I don't know exactly the reason why he's not, but I think that could be one of the reasons. But ultimately, he might want to get vaccinated. I had recommended publicly that both he and Vice President Pence ultimately get vaccinated. And as you know, the Vice President got vaccinated today publicly, which was really good. I like that example, not only of the Vice President, but also for Surgeon General Adams to do that. I think that was a good thing, representing to the community, to the people watching, that this is something that we all should do, because we get the majority of people in this country vaccinated. We're going to turn this around for sure.
Yeah. Surgeon General Adams, the stats are staggering. You know, I mentioned them at the top of the show. One recent study that found nearly 1/3 of Black Americans remain hesitant to get the vaccine. You're going to these communities to try to change that, right? Tell us what you're doing.
Well, absolutely. And one thing I do want to say is that we talk a lot about vaccine hesitancy. We don't talk enough about vaccine confidence. Yes, these numbers need to move further in the right direction, but just a month ago, 30% of people said that they would get the vaccine. 2 weeks ago, it was up to 60%. Now it's up to 80% total, according to surveys. I want people to know that more and more people are finding out about this vaccine and they're getting it. But what I'm doing is really starting by asking people what their concerns are. And you mentioned this earlier. People talk about Tuskegee all the time, but a lot of people don't know what happened. In 1932, black men who had syphilis were recruited into a government study and told they would be treated for their syphilis. Unfortunately, there was never an intent to treat these men. It was intended to follow them. But what's really horrific is that 15 years into that study, they actually came up with a treatment for syphilis, an effective treatment, and it was not given to these men. And this study went on for 40 years. And what people don't know is the Office of the Surgeon General actually oversaw that study, the United States Public Health Service. So every day I walk into my office, I walk past a wall of men who actually did this to people like me. And I'm sorry it makes me a little bit emotional when I talk about this, but this is something that we have to acknowledge. We have to acknowledge that this has happened to people, and that mistrust comes from a historical place. But we also have to explain to people that, hey, we put protections in place to make sure this could never happen again. The Office of Human Research Protections was put in place after Tuskegee. We have independent data and safety monitoring boards. You've got the FDA VRBPAC committee and the CDC ACIP committee, which are independent people with people of color on those committees looking at it. And as Dr. Fauci has said, my good friend, Dr. Corbett at NIH, is an African-American female PhD, one of the smartest people I know, who actually developed this vaccine. We now have many people looking to make sure these vaccines are safe. And I want people to know that. And I'm working with trusted influencers, Steve Harvey, faith leaders like T.D. Jakes. We want to make sure people who are trusted in the community have the facts, because if they feel confident, the people who look up to them are going to feel confident.
If I can just jump in, I want to follow up with the Surgeon General. This made you very emotional. And listen, you say we should talk about vaccine confidence, but there are this is why we're doing it. There are many people who are black, African Americans out there who don't have the confidence in the government. What are you hearing when you're out there talking to people? Do they become as emotional as you about not having trust in their government?
They absolutely do. And we talk about historical wrongs, but one of the things we need to talk about are wrongs that are still going on today. When you look at COVID-19, the fact that you are 3 to 5 times more likely to end up in a hospital and or die if you're African American, Hispanic, or Native American. Those are wrongs that are going on right now. And we talk about pre-existing medical conditions, but we've got to start talking about pre-existing social conditions, transportation, safe, affordable housing, a good paying job. 1 in 5 blacks and 1 in 6 Hispanics has a job that allows them to telework. So when we tell people, telework if you can, what does that mean? We know people of color are more likely to live in densely packed urban areas and in multi-generational housing. So when we tell you to go home and isolate or quarantine, what does that mean? We need to dig deeper. We need to address these social wrongs that are going on now. And that's one thing I'm trying to do, and that Dr. Fauci's trying to do, and that we're trying to do as part of the task force, is address these issues so that people see, hey, you really are trying to correct these wrongs. People need to know that you care before they care what you know.
Dr. Adams, Jerome, thank you for sharing some of that history. As much as I've read, I didn't even know some of that, so thank you for sharing that. Dr. Fauci, we'd like to get to some viewer questions, if that's okay. This first one is a video. Please take a look.
Was race or ethnicity a factor when they selected participants for both the Pfizer and Moderna vaccine trials?
Dr. Fauci?
Yeah, well, we made a very special effort to get adequate representation of not only African American but also Latinos in the trials. Certainly what we did, we monitored them literally on a weekly basis to make sure that the relative percentage of individuals of the minority groups that were in the clinical trial were actually representative of the demographic proportion in the population. So we didn't quite get to the 13%, which is the African American proportion in the population. In the Moderna trial was somewhere around 11%. About 18% of the population is Hispanic. We got up to about 21%. The reason why it is so important to get individuals in the minority group into the clinical trial, because when you show then the data that this particular candidate, in this case recently Moderna, is both safe and highly efficacious, that it is safe and highly efficacious in the minority populations. It builds confidence rather than saying, we're not really quite sure what it will be like with you. When you're in the trial, we know that, in fact, it is safe and it is efficacious in you. And that was really one of the very positive things about that trial. It represented the populations as they exist in the community.
And we can show
And
some of these
Sanjay,
numbers.
I just want to say,
Go ahead.
I just want to say thank you to the people who participated in these trials. And when Tony and I, we've worked a lot with these companies. When we ask people, why did you participate in these trials? People of color, they consistently said, because I've seen the impact that this virus has had on our communities. That is why we wanted to participate and get this vaccine for you. And so what I say to the people out there is there are many brave people from your own communities who stepped up to make this possible. And what would be a real shame is if we had a tool to end this pandemic, to end this tragedy, but it was not equitably taken up by society.
No doubt. I mean, I think that is precisely the reason that we're here tonight. And let me show some of the numbers that Dr. Fauci, you were just talking about with regard to the FDA trial. You can see sort of the proportions. In the Pfizer trial, 9.1% of the participants were black. In the Moderna trial, data shows that 9.7% of the participants were black. You talked about this, Dr. Fauci, but I'm curious, do you try and get a participation rate that is equitable with the percentage in the population, or in terms of the burden of disease? We know Black Americans were much more affected by this. How do you make that determination?
Well, Sanjay, I wanted to, and we were pushing, didn't quite get there. I wanted it to be representative of the burden of disease. In other words, over and above the actual demographic representation in the population. We did not quite get there, but I wanted to get at least to the relative proportion that is in the population. But as you said, the burden of disease, not only of the likelihood of getting infected because of the nature of the jobs that minorities have. They're out there, they're in the community, they're doing the essential jobs that put them to be exposed. They have a double whammy because once they do get infected, they have a degree and a relative incidence and prevalence of the underlying comorbidities, which make it much more likely for them to have a serious outcome once they are infected, which, as Jerome said, is an extra special reason of why we have to get the minority community vaccinated, not only for their own health, the health of their families, but the health of their community. It's essential. They have a greater burden of disease. It would be a terrible shame if the history of the difficulties in the past that Jerome mentioned, that if that keeps people of color, brown and black people, from not getting vaccinated. So you might see Jerome and I out there talking to black churches, talking to individuals of various minority groups, essentially pleading with them to ask us the questions of what is it that might make them hesitant. And if they are hesitant, how can we explain to them, based on the data, why it's essential for them to get vaccinated?
Surgeon General Earlene in Virginia has a question for you via video. Here it is.
Should people who already had COVID-19 get the vaccine? And can you get COVID-19 twice?
Surgeon General?
That is a fantastic question, and the answer is yes, you can get COVID-19 twice. There have been several cases of that documented, and yes, people who have had COVID-19 should get the vaccine because right now we know that the antibodies that you generate after you've been infected start to decrease after about 3 months. They've seen that in the laboratory. We don't know if that means the immunity goes away or not. But again, some people have been infected twice. And we also, in the studies, have people who had been previously infected and who got vaccinated. So we know it's safe. We want you to be protected. If you have questions, ultimately you should talk to your healthcare provider before you get vaccinated. But yes, Arlene, it is safe, and yes, we recommend it.
All right, Dr. Fauci, Surgeon General Adams, we've got to take a short break here, but I want you to stick around because the audience has a lot more questions for you. And later, we'll meet two people doing hard work in communities helping vaccinate against vaccine hesitancy, sometimes just by listening.